This is my wound irrigation and dressing change video. So the first thing I would do is go over the nursing care plan and look at the area related to the wound care. And then after that, I would go ahead and perform hand hygiene and put on my PPE if indicated. After that, I would identify the patient and check their wristband and verify their name and date of birth. And at the time, I would also check if they needed any pharmaceuticals to help with pain. And if they did, I would administer those and then wait 30 minutes until I redress the wound. And then I'm going to go ahead and I close the door for privacy. I have my bed at a working level, and then I'm going to go ahead and get some clean gloves on to remove the old dressing. So I have my clean gloves. And then I'm going to use the push-pull method to get the old dressing off. And if it was getting stuck, I would use some normal saline just to help encourage the bandage off. And so I'm getting that off. Then once I have the old dressing off, I'm going to look for the amount, color, odor of the drainage, and then also make note of that. Then I'm going to throw that in biohazard. And at this point, I'm going to go ahead and stage my wound, check for any necrotic tissue, any eschar or any tunneling or anything like that. And you're also going to go ahead and measure it. So we're going to measure the length, width, and the depth. So it's about 6 centimeters wide and 5 centimeters long, and then about a half a centimeter deep. So after that, I'm going to go ahead and get these gloves off and then perform hand hygiene once again, and then I'm going to start setting up my sterile field. So the first thing I'm going to do is get the sterile drape. I'm going to go ahead and open it away from me, and I'm going to be sure to only touch the corners. And I'm going to throw that away. So I'm going to lay this here, and then I'm going to go ahead and open this stuff and toss it on there. Then I'm going to put this under the wound to catch any drainage. I'm going to leave this over here. This. And I'm going to also open up my skin protectant. And then I'm going to get my tape. And then also I'm going to label my tape with my initials, the date, and the time that the dressing was changed. Alright, and then we would also, if we had any medications, we would squeeze that onto the sterile field. And then now these would also be packaged, and I would put them on there. That's all garbage. And then I'm going to go ahead and perform hand hygiene once again, and then put on my sterile gloves. So I'm going to put on my sterile gloves. Then also, before I put my sterile gloves on, I would have poured some of this into there. So the first thing I'm going to do is set up my sterile field now that I have my sterile gloves on. I'm going to go ahead, I'm going to get rid of this because I don't need that. I'm going to make sure that the cap is off of that. I don't need this either. And then I'm going to go ahead and I'm going to make sure I stand away so I'm not contaminating my sterile field. And I'm also going to fan some of these beforehand just to make it easier for myself. So the first thing I'm going to do now is I'm going to irrigate the wound. I'm going to come over here, get some I'm going to get some saline, and then I'm going to irrigate the wound. And then now this is going to be my clean hand, and this is my sterile hand. So I'm going to irrigate that until it is coming out clear. And then after that, I'm going to take my sterile hand, get some gauze. Well, actually, after I irrigate that, I'm going to use my clean hand to get that, and then my sterile hand to get this out. And then I'm going to switch, put on the skin protectant. Then at this time, you would also put on any medications that you need inside the wound. Then I'm going to soak my gauze in the saline over here, get that nice and wet, and then I'm going to wring it out and then fan. And then also with my sterile hand, I'm going to grab a cotton swab and pass it to my clean hand. So I'm going to kind of fan this out if I can. Alright, and then I'm going to pack the wound. And then with my sterile hand, I'm going to grab more gauze, place that over it. And then I'm going to grab my sterile hand, my ABD pad, and I'm going to pass it to my clean hand, put it on there. And then now this is going to turn into a clean procedure because the ABD pad is on. So I'm going to go ahead and tape that on. And then I'm going to remove my gloves and perform hand hygiene and remove any PPE if I have any on.